Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. Tonight we're joined by District Attorney Joe Gonzalez, as well as Dr. Lynette Watkins, who's the Chief Medical Officer of the Baptist Health System, and this is our COVID-19 update for the San Antonio community. Tonight we're reporting 185 new cases of COVID-19, which brings our total to 44,641 in our community since the pandemic began. Our 7-day moving average of new cases now is 138, so that ticked down again overnight, which is very good. We do unfortunately have a number of new deaths to report tonight, 21 in total, bringing our total to 677 verified deaths. Some of these, of course, are from the state reports, and they've now been verified, and they date back to May 24th through August 17th. 9 of the 21, in fact, were confirmed as COVID-related by Metro Health from the death certificates that were provided from the state of Texas. Over in our hospitals, conditions continue to improve slightly. We are now reporting 532 new cases, 532 people in the hospital currently, which is down 14 from yesterday. We've had a little bit of an increase in new admissions, 66 new since yesterday, but another decrease in the number of people in ICU, 239 tonight on ICU. 163 folks are on ventilators, and we want to think about them and pray for their recovery. We have 56% of ventilators available in our community today, as well as 15% of hospital beds. So our hospital system remains under high stress, and the total number of, the total proportion of admissions to our hospital system that are COVID-19 related is now at 14%. Let me turn it over to Judge Wolff.
Yeah, thank you. And as our numbers look better, we just need to remember that we have to continue to keep this up. And there's a lot of recreational sports programs going, and if you're playing an inside recreational game, whether you winning or losing or whatever, just be sure and put that face mask up, because it can travel a lot easier on the inside than it will outside. I want to thank USAA, Wayne Peacock, CEO, the $30 million that they put up for veterans, and that's going to be a big, big help, because we have a lot of people getting sick, and many of them are veterans, and so this is going to be a big help. And Ashley Harris, I know, has worked very hard on that. I want to thank Nancy Leffler and Cody Davenport with the rodeo. We're working with them, trying to figure out how we're going to have the rodeo next February and whether we'll be in shape and all the safeguards that we're going to have to do, even if we have the vaccine. I want to give the rest of my time to the District Attorney, Joe Gonzalez, for him to say a few words. Joe?
Well, good evening, everyone, and thank you, Mayor and Judge Wolff and Doctor, for inviting me down here. I have been asked to come down to talk about a letter that I recently submitted to our Attorney General, Ken Paxton. It is a request for an advisory opinion about whether or not I have the authority to prosecute federal officials who act in such a way as to interfere with the electoral process here in Bexar County. The Texas election code specifically prohibits the interference with the integrity of the voting by mail process. And so the reason I am asking for this advisory opinion is because I was concerned with some reports that I had seen in the media about members of the local postal service that were engaging in conduct that may be tantamount to interfering with the electoral process. Specifically, I'm concerned with the removal and destruction of some sorting machines that I learned about. I've now heard anywhere from 4 to 6 different machines that have been removed. If that causes a delay in the voting process, the voting by mail process, obviously that's a concern. So my question is whether or not I've got the ability to, again, prosecute federal officials. And I'll tell you that what I'm talking about are not local postal employees. I'm not talking about the people that are on the ground that are working for the Postal Service, but I'm talking about high-level officials that live and work outside of Bexar County and perhaps outside of Texas. I'm talking about orders that come from perhaps as high as Washington, D.C., that are requiring these employees to take this kind of action that, again, could serve to interfere with those individuals that wish to vote by mail. It's troubling enough that this conduct, this action, is causing delays in the mail system. You know, when you think about the citizens that rely on our mail system, when you think about people that rely on getting their medications in a timely manner, when you think about people that rely on the mail systems to get their Social Security check so that they can pay their rent, when you think about even small businesses that rely on our mail system that can't afford to use the private delivery system, that all is outrageous to begin with. But when you start talking about actually interfering with the right to vote, which is cornerstone of our democracy, then that's when I think I have to step up. And so that's what I'm doing. I'm asking the Attorney General to give me his opinion about whether or not this is something that I have the ability to do. Hopefully I'll hear from him. Hopefully I'll get a quick response because, of course, time is of the essence. You know, the general election is around the corner. Early voting starts in a matter of weeks. And so the sooner that we hear from him, the better. So hopefully we'll get an answer, as I say, and hopefully we'll be able to make a decision before the election.
Thank you very much, Joe. And as always, if you need assistance during this crisis with rent, with utilities, with any number of things that you might be facing, go to the website at covid19.sanantonio.gov, and you can also get updates on COVID-19 in our community by texting COSA-GOV to 55000. Dr. Watkins, myself, the judge, and District Attorney are available for questions.
Mayor, you mentioned this last week that we can be expecting city parks to close for Labor Day. Do we have an update to that?
Yeah, we're going to be following Bexar County on that. So again, we are still in the red zone with regard to the transmission, and we want to make sure people are avoiding crowds. And one of those things that we can do is make sure people aren't congregating in our parks.
And just pivoting over to the City Council today, I know that they adopted a new declaration declaring racism a public health crisis. I was hoping to get your take on that and why that's a step forward for the community.
You know, I think it starts with a recognition that government policy, especially those, you know, in years past, can create disparities and create inequities, and racism institutionally or through policymaking or you know, through even interpersonal settings can have real impacts on public health. So the first step is to declare it as such, and then to build policy and begin to plan from it. And so what the City Council did today was in an effort to start that process and address inequities. We know, for example, redlining policies that have long been stripped from our books continue to emanate today that result in health disparities, so much so that we can track life expectancy differences from one census tract to the next. We have to address those inequities by actually addressing the historical nature of them. So we are now, for instance, improving infrastructure in areas of our community that have been underinvested in. So we have to build policy that recognizes the roots of inequality and the inequities, and that's what the council did today.
Mr. Gonzalez, today we heard there were up to a swarm of police cars, up to 20 at the main postal facility on Perrin Vital Road. I don't know if you've heard of that or if that has anything to do with you looking into the possibility of filing criminal charges.
Well, that's certainly something that may potentially be a factor that we look into. I've been made aware of an allegation that some mail that was backed up that had been secreted or removed from the premises before Representative Castro came onto that location. Certainly that's something that is worth looking into. Again, what we're asking is to be able to identify the scope of my office to prosecute conduct such as this. We would hope that some law enforcement agency would be able to investigate this and then perhaps bring us a case, and we certainly will look at it to determine whether or not there's any criminal conduct or criminal wrongdoing.
So for clarification, is that why the officers were there today?
You'd have to speak to them. I wasn't aware that they were there until you just informed me, but it's possible that that's connected to what I've been referring to.
And if you don't hear back from the AG, does that mean that you'll still file criminal charges?
It certainly is an option for us. I mean, AG's opinions are advisory. They're not binding. I would prefer to have some direction from him. But if he doesn't respond, then certainly we're going to have to consider other options in our office.
What would those other options look like?
Potentially requesting an investigation from an agency, for example, like the Texas Rangers. If they were able to investigate and file a case with us, then we would review it and determine whether or not, again, there's any wrongdoing and whether or not we would be able to present a case to a grand jury if it amounts to a felony. Even if that happens after the election, we certainly have the ability to prosecute those kinds of cases. So that's what we're going to be looking at.
I know you mentioned that you aren't going after anyone on the local level. Who exactly are we going after here in terms of the top federal officials that you say that could lead up to D.C.?
Well, that's the issue is we don't know who it is that is directing this. We don't know who has ordered these, for example, the destruction or removal of these sorting machines. So we don't know where it will lead us. Certainly, it's possible that this may involve some top-level officials, and so we're just going to have to wait and see when and if we get an investigation filed in our office.
How soon before we seek other agencies to assist with that investigation? How long are we giving the AG to respond to your request?
Well, generally speaking, after an AG receives a request, he's got up to 180 days, so he can certainly take his time. That's why I'm hoping that he acts and responds sooner than later, because again, as I mentioned, time is of the essence. The election is only months away, but he certainly does have that much time to respond.
So then do you have a deadline for yourself then if he could take up those 180 days?
Well, we're talking about that now. I mean, obviously, we're going to give him a reasonable amount of time to respond, and then after which we'll make some decisions about what we think we should do.
Mayor,
Oh, go ahead, Bruce. Sorry.
we have a text question from Brian Chesnoff at the Express News. The statewide positivity rate has been thrown into question due to the backlog test results and outdated systems and inefficient methods used by the state. Can San Antonio residents trust the accuracy of local positivity rate reported by Metro Health? If so, why?
Yeah, so what I'll answer by saying this: the San Antonio data that's being presented it has a very high level, high standard of accuracy, and what we have been doing and the standard by which we have been measuring positivity has not changed, as it seems to have been doing at the state. The positivity rate that we've been reporting to you since this pandemic began is a function of test results that we get back directly from the labs, and we get them directly from the labs whether they send them to the state or not. And it is how many positive tests we have, how many positive cases we have, divided by the total number of positive, negative, and inconclusive tests. So we are getting those back from the labs on the day that they are reporting them. And sometimes there are backlogs at the state that slows down their numbers, but we're getting the bulk of those results back directly to us. And at this point, we don't have any backlogs that we're aware of at the state that are impacting the San Antonio area.
Do we know more about the recent pediatric death? Did we have a number on the age and particularly the health conditions of that person?
Yeah, so we do know that that person had underlying health conditions, some chronic conditions, and the patient was 18 years old. That's all the information, identifying information I have at this point.
We also have a question about an elderly person who is reported deceased today. Do you know the exact age of the person who is from 100 to 110 age range?
I don't have the exact age. I do have that age range, though. A Hispanic female between over 100 years old.
Wow. First person over 100 to pass from COVID?
I think that, if you give me a second, I can look. I think that might be our second centenarian. But if you want to, I'll look it up while we're answering other questions.
Dr. Watkins, I'm curious, as a hospital leader, can you give me your take on the decline in the hospitalization?
I think it's been a very positive trend, and it speaks to the hard work that the community has done in practicing good public health tactics such as wearing masks and social distancing and hand hygiene. And we are seeing the benefits of that now. It's very positive. We've had a significant decrease both in patients that have been admitted to the floor as well as those in the ICU. We're not there yet, and we have to remain vigilant in continuing these very, very important practices. But in addition to the community rallying together, the hospital systems, our leaders in the community have all rallied together, and I think it's been a real testament to our collaboration and coordination in this area.
And that was the second patient since this started to pass who is over 100 years old.
Dr. Watkins, I was hoping you could tell us a little bit more about the follow-up when these patients are released from the ICU and after they've recovered from COVID-19. We know we've seen some success stories, but what is the follow-up that you guys are having with these people?
So there are a multitude of ways that we follow up with patients, and we make sure that whenever a patient is discharged, they're discharged safely to the most appropriate facility. It may be to home. It may also be to a post-acute facility, such as a long-term acute care facility, particularly if they need additional help with breathing, with getting back up on their feet and resuming daily activities. So we have a whole arm of our hospital organization called Case Management, who works with both our physicians and clinicians, as well as those in outside facilities, to help make sure that that transition with the patient and the patient's family is done safely.
Dr. Watkins, yesterday I interviewed the CEO of Methodist Hospital, and he had mentioned to me, because of the decline in hospitalizations, that they're scaling back on some of their COVID units that they created, closing them down. Is that something that your hospital system is doing?
So what we're doing at Baptist Health System is a redeployment of our COVID units. Some have been transitioned from taking necessarily have COVID-19 as a primary diagnosis. We want to continue to emphasize that we are open to taking care of all patients, including those who don't have COVID as a primary diagnosis, but still have very important issues that they need to take care of. If, for example, someone has a cancer diagnosis or needs heart surgery or needs other types of treatment that is necessary to be in an inpatient setting, we remain ready in order to take care of those patients. So we redeploy our units and our resources, but we always stand ready to ramp up if necessary.
Mayor, would you please comment on Governor Abbott's announcement that he would pursue a property tax revenue freeze for cities that, quote, defund police departments?
Yeah, so we're going through our budgeting discussions now. This is a process that the community and the city and council is engaged in currently, but it shouldn't be any surprise to anyone that here we are again with the so-called small government bureaucrats in Austin playing Big Brother.
As of today, are funds still available for residents who can't pay their rent due to job loss related to COVID?
Say that again?
Are there still funds available to help residents pay their rent?
Yes, let me be really clear about this. There are funds available in our rent and emergency housing assistance fund. And the bar that the council has set is that residents who have been affected by COVID-19, we want to be able to assist them. We don't want to have to turn anyone away. So we are committed to ensuring that funds are available to folks, and as those funds are drawn down, we will continue to evaluate additional resources that can be put into that fund.
And are there any current legal protections for renters who, amidst the COVID-19 pandemic, can't pay the rent, especially after the CARES Act moratorium ended at the end of July?
The only, the only thing that's happening is the JP courts handle most of all the evictions. And I know the JP courts are, leaning over backwards to help that person and try to work out a compromise with the landlord. So that process is ongoing and will continue.
Do we know how fast these applications are being processed? I think the last check I saw that there was over 20,000 applications as of yesterday for these people that are seeking funds. How quickly are they getting processed?
I couldn't give you an actual number. I can look into that, but they're working through them very quickly now. There was some initial trouble back in May when we were first bringing the program online, but I think we've staffed up over 100 people at the center providing services there. So we're getting through them, and I think the number was 21,000 yesterday. Okay.
Before I came in here, I saw the TEA and the state are going to have its own COVID-19 tracking systems for public schools. Is that going to change anything on the local level?
Well, according to the Attorney General, it doesn't matter what those indicators are. So we're continuing to advocate for folks to listen to our local public health authorities, which are working directly with the schools and making sure that we're tracking and reporting the data that's actually happening on the ground.
Mr. Gonzalez, going back to you really quickly, whenever you find out whoever is responsible, what is the likelihood of you actually bringing these top officials to San Antonio to be prosecuted?
Well, I think it would be definitely a challenge. I think it would be difficult to get anybody to come down here to face prosecution. One of the questions that we're asking of the AG is whether or not we can actually conduct a trial and hold that person for trial in absentia. In other words, if that person never comes down here to be booked, fingerprinted, processed, released on bond, can we go forward with the prosecution? So that's definitely going to be a challenge, and I suspect that will be an issue for us if we get that far.
Thank you.
Thanks, everybody.